Welcome to Open, everyone. I'm Rhina Valentin, your hosty Café con Leche, for the next hour. You know, we're always inviting you to get social with us. That's right. Tweet us on a line and follow us on Instagram at BronxNet TV, or like us on Facebook at Open BronxNet Television. And of course, don't forget, while you're there, follow me on Twitter, Instagram, FB, Snapchat, Insta Stories, LinkedIn at Rhina Valentin. All right, so as January comes to an end, we couldn't let it slip by us without acknowledging National Glaucoma Awareness. And well, this is considered the sneak thief of sight because there are no symptoms for the disease. It is the second cause for blindness, according to the Glaucoma Research Foundation. More than 3 million people have glaucoma in the United States. And here to inform us more about the eye disease, we welcome the director of the Glaucoma Division at Montefiore Hospital, Dr. Jeffrey Schultz.
Thank you so much. Thank you so much for inviting me.
Yes, well, we're happy to enlighten our audience about this terrible disease that seems to be expanding throughout the years, I understand.
Well, you know, glaucoma is one of the leading causes of irreversible blindness worldwide, nationwide. It's a slowly progressive disease. It's asymptomatic. 50% of the people that have glaucoma don't know that they have glaucoma, okay? And it's typically a slowly progressive disease, so people don't know it, see it, till it's too late.
Okay, so is this something genetic?
Well,
is it inherited?
You know, most everything that we're learning has genetic, at least predisposition. So there are forms of glaucoma where we know that there are strong genetic links, but there's a strong family predisposition, but that doesn't mean that if you have a family history of glaucoma, you will definitely get it, nor if you don't have a family history, you can't get it.
So let's say you are diagnosed with the early stages of glaucoma. Is it preventable, or is
well,
is
it's
it just
treatable. It's treatable. You know, glaucoma is not a disease that we can cure, but we can treat. And it's important to treat it because there's data showing that, you know, that over time your risk of losing your vision and becoming blind from glaucoma is real. Some studies have shown that 10% of people are bilaterally blind after 20 years of glaucoma. Now, hopefully, with newer therapies and newer treatments, we can prevent that from happening.
So when you say it's treatable, you're prolonging it from, or your eyes from becoming
glaucoma is
blind.
Glaucoma is a slow change in the optic nerve, and the optic nerve is the pathway that takes the vision from your eye back to your brain. So if the optic nerve isn't working, no matter how well your eye can see it, if you have a good camera, okay, but there's no connection, you know, back to your computer, you're never going to be able to see the picture.
So, okay, so when you go to the eye doctor, you have to specifically ask for this type of test, or is that part of your eye exam?
There is no specific glaucoma test. And a lot of people think, oh, yeah, the doctor did a glaucoma test, they checked the pressure in my eye. It turns out that the pressure in the eye is a risk factor for glaucoma, but it's not the only factor for glaucoma. And you can get glaucoma at any pressure in the eye. Glaucoma is a change in the nerve. If your pressure is high, that's a risk factor for it. But half the people with glaucoma have pressures what would be considered normal, at least in one setting.
So there's no symptoms. There isn't really a specific test that you can take for it. So how does someone know whether they may get it or if it's on the rise?
The only way to know is to be examined. Okay, so you know it's recommended that people who are at higher risk, and that includes African Americans who are at greater risk of glaucoma. 1 in 7 African Americans over the age of 80 has glaucoma. Okay, and that's a scary number. Okay, there are certain Latinos are at greater risk of glaucoma. If people are at higher risk, they need to have a routine evaluation, and somebody will, you know, not do a glaucoma test, but they'll look at the entire eye. They'll look at what the pressure is in the eye. They'll examine the optic nerve, and if anything looks suspicious, then they'll go on to get additional testing.
So then, what would someone ask for if it's not a glaucoma test?
It's really
to
be a comprehensive eye exam.
A comprehensive eye exam,
yeah.
Not just a regular eye exam.
Yeah, well, I
Well,
mean,
because
theoretically, it should be the same thing, but it's not somebody. It's not going in and just getting a refraction or being checked for glasses. But it's really, it's looking at the front part of the eye, looking at the back part of the eye where the optic nerve is, measuring the pressure, and then interpreting that information and deciding, what, we may need to get other tests. And none of the tests are painful, so it's
yeah, I just want to be clear with our viewers because, most people go, they get their eyes checked annually, and they just do a routine eye check, whereas this requires a little more technology, right? To kind of get
your eyes need to be dilated. It's a thorough eye exam.
A thorough eye exam.
Yeah.
Okay, I just want to make sure that everybody's aware of that because, again, those numbers are scary, and it is something for us to take into consideration. I say us as in people of color because it seems to be higher. Why is that?
We don't know. Okay, but there are multiple studies that show that not only is glaucoma more prevalent or happens more frequently in certain ethnicities, but it tends to be a more severe disease.
All right. So, are there any last words you'd like to share with our viewers regarding getting an eye exam and glaucoma?
I think it's very important for people, as we get older, because risk of glaucoma goes up as you get older. That if you're over the age of 60, you should have your eyes examined, once every year or two. If you're at a high-risk group, African American, Latino, starting at a younger age, starting at the age of about 40.
Of about 40. So basically you're saying your eyes should be examined every year if you're at a higher risk of obtaining glaucoma?
Every year or two at that point.
Every year or two.
Yeah, and then based upon what the doctor sees, they can then recommend what the follow-up should be.
And so if they go to Montefiore, should they ask for Dr. Schultz?
Well, we have a large staff of excellent physicians, and they're all qualified.
Yes. Well, we thank you for coming here and sharing it with our viewers.
Thank you so much.
Absolutely. Thank you, Dr.
Okay.
Schultz. Once again, you guys, for more information on glaucoma, please visit montefiore.org.